Well, good afternoon, everybody, and welcome to the Healthcare Quality and Risk Matters After Show. This is our March 2025 edition, and we're talking about mastering patient safety. My name is Gary Bierc. I'm the CEO of Aperitisoft Healthcare, and I am joined by my two most esteemed colleagues, Rob Santamoor, our COO, and Dr. Timothy Brown, who is our head of customer success. Those two guys are the healthcare experts. I'm your risk guy. Don't pay attention to me. No, really. We just got done having a great show. So if you were on our live show, welcome back for the after show. And we are tackling the safety management process. And where we left off in the live show was that there is a process that we should be doing, but most organizations are not actually following all these steps. And there are a lot of gaps. There's issues with systems that make it possible to do it. And, you know, what I like to get into here is first, let's talk about why not? Why are people not willing to get the right systems in place to do what is necessary to save lives?
So I can tell you what I've been told too many times to count. There's by hospital executives, and it is all boiled down to, we've been using this for 15 years, 20 years, 10 years, and it's too integrated into our organization to make that change now. Yeah. And I don't understand. So they keep identifying gaps. They keep identifying issues with the systems that they have. There's holes that can't be filled. So then they do have to buy something else. And for some reason, we are so worried about going and cutting out all of that bad and replacing it with something good. Like, it seems very simple. And I know that it would take a lot of work, and that it would be a year-long project for some organizations, and that there would be some struggles and stresses that would happen. But it would just be so worth it. The problem.
Wow. I mean, let's be cold-hearted CFOs first. Right. So cold-hearted CFOs, you're spending, let's say you are a 250-bed hospital. Okay. Sure. You're probably spending somewhere between $300,000 and $500,000 a year on a system that doesn't do all the things you need it to do.
Agreed.
Right. Correct. Why would you not want a system that would be about that or less, that can do all of that and more, and go beyond that, improve all your quality metrics, and save lives?
Yeah.
It seems that if I have taken an oath of do no harm, you know, I need to think beyond the fancy new orthoscopic surgery technique that I can buy, and think about some basic blocking and tackling, going back to, like we talked about, my mom in the hospital with a bleeding ulcer that's this big, and they give her orange juice to drink. I mean, you just think about this stuff. And who knows? She had been given 2 units of blood when she got into the hospital because of the ulcer. The very next day, they give her orange juice and she bleeds again. Who knows? That orange juice could have caused additional bleeding, which meant she had to have another 2 units of blood before the GI doctor could go in and do the procedure to block the bleeding.
But if you're not capturing adverse outcomes, then you have no correlating or causation factors that you can really start to look at. Right? And especially, like, back to what Timothy said about culture. If your culture doesn't tell you to, hey, report anything that doesn't go well, and let's figure out how to just make sure that those that didn't go well this time don't go bad next time. It's very easy, right? But we don't have the right culture set up, because one, it's let's keep the same systems that we've always had, even though we know that it doesn't save lives. And two, There's that sounds too hard. I just don't want to do it. Be like,
Oh, Timothy, Timothy, come on now.
I was gonna jump in there. Yeah, I was waiting for the space to jump, but what I'm hearing, and honestly, from based off of what Rob said, this is what I heard. We have not had an incident big enough to make us make the change.
Ow!
oh, yes,
Wow!
yes,
Wow! 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 Okay,
yes.
so okay, nobody's taking me out to jail. We're not going to be shut down yet. So why do we
Yeah.
need to do this?
And we're saving lives already. So we're doing our job, if you want to call it that. But are we doing it well is the real question. I think that's what we're trying to get down to the point of. You can do your job. You can do it. You can do the best job that you think you can. But then there are tools and resources that are available to do it well.
Yeah.
I think that's the difference between good and great. To take that extra step from good to great, you have to do something different.
Let me ask you this. I'm going to go back to you, Timothy, with this. All right.
Sure.
We need to get people to understand that because they're used to a system, sensory after show, like Midas, okay, that is really, or the main purpose of it is incident reporting. That's really what it's there to do. And it's not easy to use. And I'm a nurse. It's taking me a lot of time to get that reported. And maybe, Timothy, from your vantage point, it could be a cultural thing where they're afraid to report anyway, right? But then when they have to do it, it takes a lot of time. So it's a lot of negative pressure to not report.
All right.
In that scenario. And then they're afraid that, I want to, get a new system. Here we go. It's going to be hard. I'm going to have to learn all this stuff. Oh, my goodness gracious, all this. What they don't realize is that a system like Aperitisoft Healthcare, no, you'll learn how to do a reporting in 5 minutes.
Correct.
And your reporting is going to be easy, and you can spend all your time focusing on your job.
Yeah, there are many myths around making a system change because honestly, some of those myths have some validity in them as well. There are systems when you make a transition from one to the next, they don't communicate. They wreak havoc on the entire organization. Mm-hmm. Employees complain about it. We all have been there.
Experientially, you're saying there's a lot of baggage.
There's some baggage to that, understandable. Yeah. But in this particular case, we're telling you that we're able to make that transition switch for you as painless as possible. When we're talking about incident management, there's not going to be a disruption in change and being able to report. As Gary said, you can teach your entire organization in as little as an hour how to do this. And I promise you, once they get the hang of it, the change and transition, the ease of being able to put the incident in and to be able to track it all the way through CAPA management, through incident management for the entire organization, how seamless it is. It just makes no sense to me why a lot more organizations haven't made that transition. I know there's a lot of red tape in the background too, relationships and things of that nature that are tied into it as well. But
we're talking about a material, a game-changing shift.
Correct.
Using a system like Aperitisoft Healthcare over the other legacy systems. There is that much difference in technology. Why is it so easy, Timothy? I'm going to stay with you. I'm sorry, Rob. I'm not trying to ignore you.
Oh, that's okay. I love what he's saying, so it's great.
Right. So, Timothy, why is it that they're so quick to get the latest iPad for their healthcare records and the latest this and the latest that, but they're not willing to take and get the latest system that could, we're talking a lot of lives, right?
We are.
Okay.
The unfortunate thing, I look at the back end of it is it's cultural. And when I say culture, I'm talking about the entire healthcare organization system, the industry itself is cultural. We want to be out front, but no one wants to be the forefront when it comes down to innovative ideas. Unless you're, some mainstream healthcare system. There are many out there, I'm not going to name any. But unless you're the forefront where we're willing to take the risk to make a change, a lot of organizations are okay being second, third, or fourth. There's no reward in that.
So earlier,
Rob, let me give you another question. All right, Timothy said risk. Okay, risk to change.
Risk to change.
Right. Aperitisoft Healthcare. How much risk to change is there really? You're the healthcare quality expert. How much really is risk is there?
So I would argue that there isn't. So, and I don't mean to say that just because I'm advocating for the system or whatnot, because back to what Timothy said, there's pain with change. You're going to have pain. It's going, at some points, it's going to straight up suck trying to like transfer from one system to the next. People are going to be annoyed that they have to learn something new. There's things are going to fall through the cracks because you're going to require somebody to have to do something different. And I get that, but we spend so much time educating our patients in healthcare that, yeah, this is going to hurt, but if you don't do it, you're going to die. Correct. It's going to feel better in the end. And when he said that, the first thing that popped in my head is like compartment syndrome. I'm like, you're in a lot of pain right now, but if I don't go in and cause just a little bit more for just a hot second, and cut that fascia, you are going to lose your legs. Do you want to keep them? Because you're going to have a way better outcome going through that small amount of pain right now. And we're probably going to identify some other issues. Yeah. And that is what I would love to do with that.
It really gets to that prevention side that you were talking about in the live. So, guys, I'm going to let, I'm really fired up over this because my mom in the hospital and the orange juice and milk incidents. That's right, folks. My woman who has had a bleeding ulcer this big, and they gave her orange juice and they gave her milk to drink, and she's still in the middle of treatment. That is the right hand not knowing the left hand is doing. And again, I'm not going to name the hospital, but these are the kinds of incidents that make a big difference, right? When she was given orange juice, she ended up getting 2 additional units of blood. Who knows, that orange juice could have caused it to open up again, right? Because they thought that it stopped bleeding. So this is ridiculous that these things happen. But Rob, I'm going to ask you to put that chart up again for us.
Yeah.
Okay, the safety chart. For you folks that are on the after show, I'm sorry we're going to keep coming back to this, but it's a really important diagram. Let me explain to you, without giving you a demo, of what Aperitisoft Healthcare can do. We have an incident reporting capability that has deployed a triage type of technique so that when you report this incident, you don't have to do more than what you are required in your job. What happened? What did you do about it? There's going to give you some quick drop-down things so you can tell us what department you're in. You can tell us what time this occurred, what date it occurred. And then there's going to be a quick 5-question questionnaire that has a couple sub-questions, depending on how you answer the questions, answering simple yes, no, or I don't know. Some questions that are pertinent to the quality team. Once that's done, you hit submit, you're done. The average time to do this is 2 minutes. And that's all you, the healthcare staff, should ever have to be worried about. You go back to work and focus on the patient. Now, quality is going to pick it up because that same system now is going to be taking a record of that and notifying the quality team that an incident has been reported and prompting them to investigate either immediately, within 24 hours, or within a week, depending on the criticality of that incident based on how you answered those questions in the triage. They can then go from there, based on the investigation, to drive into the root causes and document all of that into the system around that incident. They go beyond that. It has an analysis capability for them to go through, again, a questionnaire-based approach to put a quality score on that incident. So if everything was perfect and there was no real problem there, it's a high quality score. But if there are all kinds of issues and misses, then the quality score is going to go down. Now, why do we want that analytical number? We want to be able to know how we can improve. So when we start taking corrective action, fix the problem, and preventative action to prevent it, it's going to change that quality score as those things are getting implemented and completed. What that means is, in this cyclical view, that when I'm monitoring, I can see that that incident initially was a score of a 50, but since things are getting done to correct it, it's moving up towards being a perfect score. Now, all of that is now tracked through a set of dashboards so that can be easily monitored what's going on around every incident in the system. So you can take this into the micro on one incident, or you can blow it back out in aggregate and look at all the incidents together and see how, as a combination, we're doing as a healthcare organization. That is a safety management system.
Absolutely.
So, guys, thank you for letting me get on my soapbox, but I had to get it out. Right? That's how things are supposed to be done. If your organization's not doing it that way, you need Aperitisoft Healthcare. You need to be talking to Dr. Brown as soon as possible.
Absolutely.
Fully agree. It, again, back to like what we were saying, it just doesn't make sense to keep doing the same thing. And if I just kept putting Band-Aids on my patient's wound, and I didn't call the wound ostomy nurse, and I didn't call for the doctor to come in and assess, and I just kept covering it with more and more and more Band-Aids to keep the wound closed, and it's just festering underneath, and I just need to put bigger Band-Aids on all the time, I would lose my license. And as I should. That's dangerous.
Yeah.
I would legitimately lose my license. There's gross negligence. And I don't know how we're not thinking through these processes the same way. And I hope that doesn't sound dramatic to where it like discredits there's my thought behind it, because it truly is. Gary, you said this earlier. These things are deciding whether or not future risk events happen that kill people.
Absolutely.
Yeah. People die because of medical malpractice, because of the incidental things all the time that we say there's one-offs, or it was a surprise, we didn't know this would happen. But if we had good analytics and we had good monitoring, we actually could have predicted it.
Right. You know, guys, I have seen in my life, being a risk manager for 40 some years, I have seen more effort and more willingness to invest in what we're talking about in a manufacturing plant than in a hospital.
Yep.
You know, and we're talking about work-related injury, which can be serious. People die working in factories. Yep. But a lot more people could die in a hospital.
Yeah, they're literally there because they may be actively trying to die, and we're actively trying to fight them on that.
It's unbelievable that you know the status quo continues to move along. We've always done it this way, and it goes back to Timothy, like you said in the beginning. Nobody's died yet that I know of because of this. I haven't been able to connect that dot that it was our process that was the problem, right? That nurse made a bad decision. That doctor made the wrong decision. That, you know, they're blaming individuals rather than their systems and their process.
And that's what we said in the prior show. Sorry, Timothy, go ahead.
No, I was going to say, if I were a new leader coming into the organization, especially around quality, even a CFO, or even any type of administrator in the C-suite, the first thing I will look at are the policies that we currently have. Anything around quality, anything around reprimanding employees due to issues of that nature, and really hone in on why are employees afraid to share what's going on in their overall units, especially if we have high mortality rates in our organization. If we are having issues around quality where we are being sued multiple times and things of that nature, I would really start to look at those overall policies that speak to employee behavior and see if they align with an organization that is focused on mastering safety management. And you can often find those policies that are really honing in on issues around if an employee makes a mistake, they're reprimanded, or they have some type of overall process to manage them out the system. Those policies are really going to hurt the overall culture of your organization and cause employees not to be honest about what's going on in their individual units. Then also would focus in and really hone in on leadership grounding and frontline empowerment. How are you empowering your employees to speak up? How are you empowering your leaders to really be there and be available for employees as they're making those overall transitions? Those two things are in place. You're going to see the high mortality rates. You're going to see the reviews on your overall website of your organization and having a 1-star. Generally, this all generally resides around these reasons.
Your leapfrog score is going to start.
Your leapfrog scores, out of whack TMS scores. CMS always showing up at the door, even the Joint Commission popping up randomly. There's a reason for that.
So what you're saying is, if you're a hospital out there and you're going through the down spiral, and we've talked about this before, call us.
Call us. We can help. We definitely can. And we're going to start with
We're not blowing smoke, folks. We have a system we can deploy quickly, and it's going to help you immediately.
Correct.
You're going to get immediate results. And we're just talking about instant reporting, and Aperitisoft Healthcare can do a lot more than that for you.
That's correct.
We're just talking about this one thing, safety management process. It can make an enormous change.
And so fast. Because Timothy's point, the culture will change with investing in the right tools.
Correct.
That can be a huge. There's resource
help, right? Help with the culture.
To leverage and say, look at what we're investing in. We are investing in your safety, the patient safety, the hospital's integrity.
Yeah.
And that means a lot to employees because there are two reasons they don't report. There's, to Timothy's point, it's culture, they feel reprisal, or they know that reporting means nothing.
It means absolutely
every
nothing.
single time I do an incident report, nothing happens with it.
I mean, I get it. Maybe I just see all this hypocrisy that drives me bananas. I mean, but
Yep.
You go to a hospital and you got all these doctors driving EVs, right? They're more worried about the planet than they are about the immediate patient safety in their organization. You know, where it's right there. And I don't know if it's just they don't know. They don't know that Aperitisoft Healthcare exists. Well, we're trying to get the word out to you.
Yeah.
But there is an answer to your problems and you may not even know it's a problem yet. But I mean, if you're a profitable hospital and you want to be a lot more profitable, you need Aperitisoft Healthcare.
Yeah. Well, I always go back to that question of what's keeping you up at night. There's generally one leader that's really trying to figure it out. Give us a call. We can talk through those overall issues. I can remember one leader that contacted us. She said she was up at 2:00 in the morning trying to find a solution. We're here. We're available. We'll definitely have the conversation with you to kind of talk through how you can better out your overall quality issues for your organization.
And folks, listen, it's not just the software tool and then we're going to walk away and you're going to be talking to somebody in India. That's not the way we do business. You're going to have a software system that's backed by Rob Santamoor and Timothy Brown that are going to be right there alongside you to make sure that it's working and deploying and operating the way that you need it to and getting the results that you're looking for. That's how we roll. I guess that's maybe I'm old guy. That's how we roll, right?
We really do care about making sure that you said it earlier, Gary, the Hippocratic Oath, right?
Yeah.
We want to help you uphold that. We want to make sure that not just you, but your entire hospital system does no harm. It is.
Yeah.
It's this there's far off dream. There's right the pot of gold at the end of the rainbow to say that you're going to be a zero harm hospital. And I can't tell you how many there's requests for grants or there's pay for performance programming or you name it that I've written for and ended it with, because we have a goal to be a zero harm hospital, or we want to work towards being a zero harm hospital. And although I do believe that the quality team and even the executive team believe that that's what they want, they're not making strategic enough, big enough, or smart enough moves to actually get there. And that does involve a little bit of there's, I guess, I don't want to say pain. It involves in you being willing to overhaul your current set of systems. And I will say set of systems. You have many that are comprising your quality, risk, and compliance systems. And be willing to either let us collaborate with them or better yet, throw them away. And have a single system that just makes sense, that is designed for a healthcare process that will help you identify risks, close out risks, and ensure that your patients are actually going to stay safe.
Yeah. Let's go back to the Grandma Bierc's use case. If she only knew what I've been doing this today, she would be whacking me. But All right, two different incidents, same problem, right? The left hand doesn't know what the right hand's doing. So the doctor says, this woman needs to be on soft foods.
Mm-hmm.
So that goes to the kitchen. The food service has a list of things that fall into the category of soft foods. Nobody is really looking at the fact that it's a ulcer. That's the problem, right? Not yet, anyway. That ulcer little factor there, that's what the medical staff's supposed to do, right? So when they send down the order, it's kind of like they have categories of foods that you can order from food service, and that's what's coming. So when that tray comes up, food service doesn't know. They're not doctors. They just pulled off stuff to fit within that category of what type of food that they needed to bring to the room. And when it comes to the room, nobody is checking. Now, Rob, you said that food is medicine, right? So, the fact that the medical staff wasn't looking at the medicine given to the patient, big gap there. Now, why is it happening? Well, probably this incident's never been reported before. Nobody's connected the dots and root causes and then went to the analysis to talk about the impact that it would have on the patient.
No.
Right? So how could this then have been corrected? Well, again, Aperitisoft Healthcare would have looked at the significance that this could have had, would have then brought down that quality score significantly, so that when the corrective action, preventive action is done, it would be able to see how now you can raise your quality because you're minimizing the impact of threat to the patient by doing the right things. It probably would be a simple thing as changing the procedure that medical staff must review all food coming into a patient's room before it's administered.
Yep.
It's a process and policy that can easily be written. And had they had a process similar to the cycle that we showed earlier, you'd be able to find that broken chain that we talked about earlier. But I think because there's no drawn out process or the organization doesn't have a policy or process that makes sense, those chains are not going to get found. You're going to have those broken chains all over your entire system. Something as simple as a missed meal or feeding a patient the wrong overall meal can lead to an unfortunate incident similar to what you're speaking of. Think about the other things that are going on in an organization that are broken that need to be fixed.
Well, a missed meal is like, to go down the rabbit hole, it can be seen as a very small problem because, hey, the patient just got annoyed. The patient got upset. And they're going to give us a bad rating. So a patient complaint, we'll just move it through the system, no problem. But to Gary's point, being able to assess impact, there's impact on that is much bigger than just the patient was annoyed. If they're a diabetic patient, you might have killed them. That's a problem. If you didn't give them a meal, and they decide that they want to go to the Department of Health and Department of Justice, they have a patient rights violation. So now you immediately have Department of Health on site costing you at least 5 figures in staff time. There's dealing with that. And if there's findings, then there's other, right?
Yep.
So thinking about impact on those things, being able to assign a value and say, okay, you know what? This was a one-off. It happened one time this year. One patient didn't get a tray and there was no harm. You know what? Maybe I will track and trend this one and see if it happens again. And I'll make sure there's good education that goes out in our annual competencies. But hold on, it's happened twice. Twice is not a person issue. Twice is a process issue.
Yeah.
And now I can say high impact happened twice, even though the actual incident outcome was low. I can make smarter decisions about how I allocate my training, my people. There's who's doing what. And just do better, right? I can do better healthcare.
Yeah, Grandma Bierc had 2 incidents in the same 2 days, right? The person who brought up her tray the first day was a different person than the person who brought up the tray the second day. Right? They were just doing their job as they were taught to do it.
Yeah. And there's no hard stops, right? Like if I was there and if I had ideal, right, I would put in all these hard stops in the kitchen. There's algorithms. Be like, if they have any of these diagnoses, none of these foods are allowed to make it to the tray. And then by the time it gets to the unit, There's who's checking that. There's doing like a quick once over, right? Like actual controls, preventative actions, not, hey, I told that food service delivery person, the dietary aide, I told them. I had a coaching session with them.
Guys, this story keeps going on. So they brought orange juice the first day. They brought orange juice for breakfast the second day, but my uncle was there, and my mother said, I just gave it to your Uncle Stosh.
Well, at least
when I was there, they're bringing milk out for dinner. It was like, you got to be kidding me, And my mom was getting smart now. She goes, oh, I'm not going to drink the milk because you said it was going to hurt my stomach. I said, yep, you could thank Rob Santamoor for that.
Well, and to have a clear liquid diet and a soft food diet and a GI-friendly diet, there's all of those things there should be assessed before given to the patient. Yeah. It's not her responsibility to know what's going to hurt her and not. It is our responsibility to provide her with that education and then to ensure that she's not unsafe.
It's just good that her son knows of Rob Santamoor. That's all.
Yeah.
Taking all that nursing advice into the hospital with me.
Nursing advice. The fear of it is for the patients that don't have a Rob Santamoor, the patients that don't have someone that can advocate for them.
Good point.
They go into the organization with the understanding that the hospital is going to do no harm. They're going to take care of them. And unfortunate mistakes happen like this. But the question is, what are we doing to prevent these in the future? How are we mitigating these overall issues? And if you don't, as I said earlier, have a process, this chain and this cycle will continue to happen until you do run into the big lawsuit or an unfortunate death happens for the overall patient. And this happens time and time again, but there's no way to track this information, unfortunately, for patients that are experiencing these.
And tragically, I mean, my mom's outcome was good at the end of the day. I mean, they're going to be discharging her today, and bleeding stopped and so forth. But it could have been much worse.
Absolutely.
Right? I mean, how fast she bleeds. She's 94 years old. I mean, it wouldn't take much to kill her.
Our fragile patients need to have the best controls around their care.
Yeah,
absolutely right.
And arguably, then those controls should extend to everybody, right? We should have universal controls to make sure that we are just doing the right thing all the time.
Yeah. So Timothy, you got to call this hospital now. You got to say
absolutely. Gladly give them a call and have a conversation if they're willing to talk to me.
Yeah. Say, I understand you don't know what the left hand's doing.
Right.
For sure.
Well, gentlemen, what can we do for last words for our audience on safety and patient safety? And what is the last word you want to leave with them, Rob?
My last word is to honestly keep up with all the other industries. Not worry about what we've always done and start understanding that we need to put the patients first. Yeah. And that is what's going to keep our patients happy and our bottom line happy. And so it's going to keep our doors open, and a very solid, there's quality management system or patient safety system is going to be the only way to do that. Disparate systems are never going to get you there. Yeah. There's too many gaps. Unless you're going to hire a team of 500 people, there's to manage each data point. Then it's just never going to work.
Yeah. Timothy, what's your last word?
My last word is kind of similar to what I mentioned in the main show. It's really mastering safety. It's not about checking boxes. You can't just have this check the box idea of how you're going to manage and overcome your overall safety issues. It's really about embedding that safety into the overall culture of your organization. And you have to build that out. It's going to take steps to do that. As Rob said, step out there and make the call. Have a conversation with an organization similar to ourselves or with us as well to really talk about how can you make that transition and change as seamlessly as possible. You've never heard a bodybuilder say, with any type of exercise that they don't have soreness. There is going to be some stretching, some pulling, some soreness with it. So be aware of that. That's totally understandable. But don't be afraid of that overall soreness, because the only way muscles grow is if you put tension on them and you make them stretch and you move them more. So utilize that muscle of creating a safety managing safety for your organization by taking the first step, which is understanding where you currently stand and where you want to go.
My last word to the folks out there is, look, if you're afraid, you think there's a lot of risk, look, contact Timothy at insights@aperitosofthc.com. We'll find a way to make this risk-free for you. Okay, we can make this a way where you can experience yourself. Some of you might be saying it's too good to be true. I guarantee you it is not. I mean, a lot of you guys have seen that one commercial out there for the patch, the pain patch.
Mm-hmm.
The guy makes a great comment. He goes, if you're thinking about getting one, you need one. So if you're right now, if you're thinking about, yeah, I would like to, you need it. You need it. Contact Timothy at insights@aperitisoftHC.com. Take the first steps. We'll figure out a way to make it a smooth transition for you. And you're going to be thanking us for that advice. Trust me. Well, folks, we really enjoyed today's show and after show. So we thank you for participating. Timothy, how can they follow us, really get the word out about our after show out there?
Absolutely. So we have a YouTube page that you definitely can look us up on. It's Aperitisoft Healthcare on YouTube. You can subscribe to our channel. And also we have a LinkedIn page as well. It's Aperitisoft Healthcare as well. You can subscribe to that, and a newsletter as well, which is our Healthcare Quality and Risk Matters newsletter. So feel free to follow us on all of those platforms, and we'll look forward to bringing
like everything and share us with everybody you know out there in the LinkedIn and YouTube worlds. We thank you for showing your interest today. Next month, we're going to be getting into Donate Life. So be looking for our show at the end of April, and we're excited to see you there. Have a great month. We'll talk to you then. Bye now.
Bye.